Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Simons. Thanks for coming in today.
I just wondered, Doctor, I got this letter from your receptionist, I think it was. I was wondering what to do with it, but it says I should come in for a routine 6-month checkup. But I think I was only here a few weeks ago, wasn't I?
Let's see now. It's October 28th today, so it's just over 6 months since your last visit.
Really?
Yeah, actually it was in March.
Oh my, time flies. I thought it was only a few weeks ago.
Yes, time certainly does fly, that's right. Now tell me how you've been for the last 6 months. How have you been going?
I think it's just the same as, no, I did have flu actually. My son, he lives in the city and he came to help me. He's my only son, that's Tom.
Okay, and was the flu, was it a bad flu? I don't think I saw you.
I think it was all right. I got better anyway.
Okay, good. And yeah, I do know Tom. We were in school together, and he did come with you on the last visit in March.
Oh, yes, now I remember. He does know you, doesn't he?
That's right, he does.
Well, anyway, he came to help me, but I'm fine now.
Well, that's good. Well, look, let's just check out a few things, shall we? Could you just step on the scales for me, please?
Oh, I don't think I've put on any weight. I've never been fat.
No, you certainly haven't put on weight. In fact, looking at this measurement, you've lost over 4 kilograms. But we'll talk a bit about that later. I'd just like to check your blood pressure.
Oh, well, that should be okay.
Yeah, it's not too bad. It is a bit higher than last time, though. Now, Ivy, does the Webster pack the pharmacist made up for you, does that help you make sure that you take the right medications every morning?
What medications do you mean?
It should have your UKVI for controlling blood pressure and the oroxine tablets to ensure that your thyroid is functioning adequately. And then there's the Lipex to keep your cholesterol levels under control.
Oh, yes. My chemist has been very good to me. He keeps track of all my prescriptions and sets everything out for me, so I know what to take each day. Of course, sometimes I notice I seem to have missed a day here and there. But one thing I always take is my vitamin C and my vitamin E. I've taken them for years and they're very good for me.
Well, I'm pleased that that's working for you, and it is very important that you take your UKVI, oroxine, and your Lipex as well. So perhaps if you leave the Webster pack in a place where you'll always see it when you wake up in the morning. Well, Ivy, can you tell me more about how you're managing on your own on a day-to-day basis?
Well, I'm managing myself, I think, but I am having a few problems. Tom got a gardener for me to help out with the garden.
Well, that must be a help for you, actually.
Oh, I don't know about that. Quite frankly, Tom seems to think he's okay, but I don't know what he's doing. I think he's stealing my tools.
That's rather unusual. What makes you think that?
Well, several things have gone missing, like my garden gloves, and my digging fork, which I use for putting flowers in, and my watering can as well. So that's why I'd like to get rid of him.
Do you have any help with the housework?
Oh, I can manage that. Oh, yes. I've got a home help lady that helps. Some help people came round and they said I could have help with cleaning the house. but I don't think these people are really trustworthy. Now you take this morning, I wanted a cup of tea. I always use my favourite teacup, and this morning it was gone. Now the cleaning lady was there yesterday, and she must have taken it. And I also think she's hidden the remote control for the TV.
Yeah, as I said, it doesn't seem normal that people would do this. You think that maybe you might have misplaced these things, perhaps?
Oh, I always put things in the same place, and I've been doing that for years.
I see. Well, maybe this is something you should talk to Tom about if it's worrying you.
Extract 2, questions 13 to 24. You'll hear a physician talking to a patient called Mr. Andrews. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Doctor.
Good morning. Please be seated. Is she your daughter?
Yes, Doctor.
What's her name and what's her complaint?
Her name is Tiara. She gets shortness of breath with vigorous play and exercise. She gets tired more quickly than the children of her age.
Does she have coughing, wheezing, or chest congestion?
No, Doctor.
What's her age?
6 years old, Doctor. Moreover, when she runs in races, she seems to have severe problems, as it seems to take her a significantly long period of time to catch her breath.
Was she admitted to any hospital earlier?
No, Doctor. She needed an apnea monitor after birth, and this was continued for approximately 3 months thereafter. At times, she has nasal congestions during the night and morning hours.
What medications is she taking now?
Nothing, Doctor.
Is she allergic to any medicine?
No, Doctor.
Her immunizations are up to date?
Yes, Doctor, but she is yet to have influenza vaccine.
While her pulmonary function test shows premature ventricular contraction, it is 1.21 liters, that is 77% of predicted. The FEV1 is 1.9, that is 81% of what we've predicted. Peak expiratory flow is 175 liters per minute, that is 82% of predicted. Post-bronchodilator, she has no change in the forced vital capacity, or FEV1. She had a 10% improvement in the peak expiratory flow up to 195 liters per minute. Her forced expiratory flow is 25 to 75% increased to 2.5 liters per second, which is a 28% improvement. Her borderline normal lung volumes as measured by the forced vital capacity and FEV1 and her flows are in the normal range, although there is some improvement seen post-bronchodilator. This would indicate that she has some airway reactivity. I have reviewed her recent chest x-ray. I've also reviewed the echocardiogram report, which shows normal. She has developed dyspnea with exertion, etiology unknown. Maybe reactive airways disease, a potential cause. She has rhinitis, probably vasomotor and infectious. I am going to start albuterol HFA as ProAir and Proventil 2 puffs via Inspir Ease every 4 hours and 15 minutes prior to vigorous exercise. She can use either Claritin 10 milligrams or Zyrtec 10 milligrams daily for rhinitis symptoms, and she may also use Sudafed 30 milligrams every 6 hours for significant nasal congestion. Continue these medications for 2 months and meet me thereafter.
Okay, thank you, Doctor.
In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a doctor and a trainee discussing the application of a plaster cast.
So let's discuss the short arm cast that you're going to apply. What are the steps?
Well, first I need to examine the area and check the x-rays to see if surgery is needed. For the cast, first I'll apply a stockinette with a hole for the thumb, and then I'll wrap the arm in a web drill for padding. After that, I need to immerse the roll of plaster in water.
Right. And what should you point out about the plaster?
I need to warn the patient that it may feel hot as it starts to set. How long does it take to dry?
The cast may feel dry to the touch in a few minutes, but it isn't fully dry for 72 hours. What's the last step?
After I've applied the cast, I need to take another x-ray to confirm that the fracture has been reduced.
You hear a manager explaining new data management processes to clinical staff.
Yes, in the back. You had a question?
Yes. How should we file our feedback reports? Do we need to just complete them on the computer?
That's a great question. Remember that since the clinic has begun transitioning to the new computers and software systems, we need you to fill out the paper reports in addition to the digital versions. I know this may be time-consuming, but this is because as we transfer all our files from the old servers to the new ones, some files may be misplaced, and we want to ensure that all of our records are easily accessible at all times.
So we need to make 2 copies of our reports?
Yes, exactly. Great. Does anyone else have a question?
You hear a presentation about the introduction of a new type of wound dressing.
Thank you all for coming. Well, after some research, the hospital has decided to invest in a new type of dressing to care for our patients with chronic wounds, such as those with diabetic ulcers. Although the traditional cloth compression bandages are useful, they need to be changed frequently to promote healing. These new bandages are made of a natural plant-based material instead. In fact, they're made from seaweed. Alginate dressings are somewhat costly, but they can prevent harmful strains of bacteria from entering the wound by forming a protective barrier with the skin. Most impressive of all, they can absorb up to 20 times their own weight, so they're the best choice for wounds with high-level exudate. Based on these factors, we believe that alginate dressing would be a useful addition to our wound care procedures.
You hear 2 hospital managers discussing completion rates for an online course.
It looks like only around 40% of the staff have completed the online health and safety course so far.
Less than half, but the course has to be completed by all staff members by the end of the month. Can we send them a reminder email?
We've reminded them by email twice already. I've even phoned a few people. I think we need to bring it up at the general staff meeting next week.
That's on Thursday afternoon, right? Will that work with everyone's schedules?
It should. All staff members have that time already blocked out. But if anyone can't come, then we can speak to them in person one-on-one.
You hear an educator describing methods for creating medical abbreviations to nursing trainees. A technical name for the use of first letters is initialing, but I prefer to use the phrase the first letter rule for this method. Abbreviations using the first letter rule commonly identify diseases and diagnostic tests. For example, chronic obstructive pulmonary disease is COPD, or liver function tests are LFTs. In most cases, these letters are pronounced separately as letters, but sometimes key letters or key syllables form the abbreviation. For example, hypertension is abbreviated using HTN, or we see the term atrial fibrillation abbreviated as either AF or AFib. Sometimes the first letters form an easily pronounceable word, an acronym. For example, acquired immune deficiency syndrome becomes AIDS, or severe acute respiratory syndrome becomes SARS. Understanding these principles will help you to more quickly learn the many abbreviations used in local clinical settings. You hear two colleagues discussing an online training course.
Hi Fiona, how are you? Can I ask you something?
Sure, Mug. What's up?
Have you done that online training for a new record management process?
Yeah, I did it on the weekend. It was supposed to take 10 minutes, but it took me ages.
Did you have any trouble with it? I mean, any technical problems?
Not really. I couldn't log in for a bit, but that was just me getting my password wrong. After that, it worked fine. Why?
I keep getting this email that says I haven't finished all the activities, and then when I log in, it says I've completed everything. It's driving me crazy.
Did you ring the IT help guys?
Yeah, they reset it, but it didn't do anything. I really don't want to do it again.
No, you shouldn't have to. Maybe just send the register an email and let her know that you've done it. Maybe she can fix the issue.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1, questions 31 to 36. You hear the discussion between a senior doctor and junior doctors on differential blood test. You have 90 seconds to read questions 31 to 36. Hello, doctor. What is a differential blood test?
Well, a differential blood test enables the physician to determine how many white blood cells are in the body. There are 5 types of white blood cells, and the test also shows how many of each type of white blood cells are present. The results provide details about the condition of a patient's immune system and its response to diseases.
Who requires a differential blood test, doctor?
A differential blood test helps diagnose a range of acute or chronic conditions. and often this is ordered when trying to confirm a diagnosis, such as for any signs of acute illness, such as the flu or urinary tract infection. Or else they may be looking for a chronic condition, such as an autoimmune disorder, or one that affects the bone marrow. The bone marrow is responsible for producing white blood cells, so changes in white blood cell counts can indicate the functioning of bone marrow. A differential blood test may be ordered if a patient has symptoms, such as body aches, chills, fever, a headache, pain, or particularly in the bones. Although a differential blood test can indicate problems with the white blood cells, it will not be the only test that is used to make a complete diagnosis. The 5 types of white blood cells are: neutrophils are the most common type of white blood cells, which are responsible for destroying bacteria in injured or infected tissue. Monocytes also destroy bacteria, causing chronic infections and a role in repairing damaged tissues. Eosinophils are responsible for treating infections caused by parasites, and they also control the immune system response to allergic reactions. Basophils are the least common type of white blood cell, and their function is yet to be defined. However, they may play a role in allergic reactions. There are 3 types of lymphocytes. B lymphocytes generate antibodies to attack specific viruses, bacteria, and other foreign invaders. T lymphocytes help to identify cells that require an immune response. The 3rd type, called a natural killer cells, destroy cancer cells and viruses. Therefore, each type of white blood cell plays an essential role in the immune system. When a differential blood test result is received, it should also contain a reference range of normal values from the laboratory to evaluate if the white blood cell levels are low, normal, or high. Overall, an increased level of white blood cell count than normal level may indicate the presence of an infection. Typically, normal values for neutrophils are between 2,500 and 6,000 cells. A person with a very low neutrophil count will have fewer than 1,000 cells, a condition called neutropenia. While the results of a differential blood test will give details about all 5 types of white blood cells, a doctor will usually focus on just 1 or 2 types. Depending on the type of cell, high or low levels can indicate different issues, such as a high level of basophil count can indicate certain types of leukemia, including chronic myeloid leukemia. It can also be an indication of severe allergic reactions. Patients with inflammatory disorders, such as rheumatoid arthritis or ulcerative colitis, may also have high basophil counts. Typically, a low basophil count does not indicate a medical condition. However, allergic reactions, stress, steroid use, and hyperthyroidism can result in a basophil count. A high eosinophil count is caused due to an allergic reaction such as asthma, eczema, or a reaction to a medication. Inflammatory disorders such as celiac disease or inflammatory bowel disease can also cause high eosinophil count. Usually, eosinophils are present in such a low quantity that low readings do not tend to indicate any health condition. However, stress or steroid use can also cause a low eosinophil count. A high lymphocyte count can indicate an acute viral infection, such as chickenpox, herpes, or hepatitis. Or else, a lymphocyte count may be high due to a bacterial infection, such as tuberculosis or pertussis, or a condition such as lymphocytic leukemia or lymphoma. A low lymphocyte level can indicate an autoimmune disorder such as lupus or rheumatoid arthritis. The presence of tuberculosis, HIV, hepatitis, or the flu can also cause a lymphocyte count to be low. A high monocyte count is caused due to chronic infections such as tuberculosis or a fungal infection. The presence of a condition such as endocarditis, inflammatory bowel disease, monocytic leukemia, juvenile myelomonocytic leukemia, scleroderma, or rheumatoid arthritis can also cause a count to be high. Most physicians do not consider a single low monocyte count as significant. However, low monocyte results on several tests can indicate hairy cell leukemia or bone marrow damage. A high level of neutrophil count can be an indication of an acute bacterial infection, inflammation, tissue death, stress on the body, or chronic leukemia. The neutrophil count may also become high when the person is in the last trimester of pregnancy. A neutrophil count may be low after an adverse drug reaction or chemotherapy treatments. Illnesses such as myelodysplastic syndrome, autoimmune disorders, bone marrow cancers, and aplastic anemia can also cause low neutrophil counts. A differential blood test is one of the different lab tests that is used to confirm a diagnosis of an infection or illness.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
We've been studying a disorder called seasonal affective disorder. Norman Rosenthal first identified this disorder in the mid-'80s. The theory is that a decrease in light during the long winter months may be responsible for triggering a chemical imbalance that in turn may cause depression among those people with a predisposition to depression. Supposedly there's an area of the brain called the suprachiasmatic nucleus, which is very close to the retina of the eye. So this area of the brain responds to light by sending a signal to the pineal gland, and the signal causes the gland to suppress the secretion of a hormone called melatonin. To make a long story short, the more light, the less melatonin in the blood. Okay, the acronym for seasonal affective disorder that's being used in the field is SAD. We didn't come up with that. And in fact, I personally think that it's an inappropriate way to refer to such a serious type of depression, since it sounds rather mild, and seasonal affective disorder can be a very severe and debilitating disorder for some people. In fact, in extreme cases, it's life-threatening when patients become suicidal. So anyway, as you can appreciate, the winter here is very dark, cold, and gray. By spring, almost everyone's tired of the gloom. But for some people, those suffering with seasonal affective disorder, it can be a serious problem. People with seasonal affective disorder experience deep and prolonged depression throughout the winter months, with what looks like a spontaneous alleviation of the condition when spring arrives. Before the disorder was identified, it was rather a mystery for friends and family, since the depression appeared to vanish only to return several months later. Now, although previous research isn't conclusive, we do know that younger people, especially younger women, these women are at a higher risk for developing the disorder and for being affected by it in a more severe form. If I recall, about 75% of those affected are women, with a typical age of onset about 30 years old. Other factors that contribute to the problem, apart from the long dark days, of course, these factors include heredity and stress. What are the symptoms? Well, the usual spectrum of problems associated with depression: anxiety, lack of concentration, a tendency to sleep more and eat more, cravings for food with a high sugar content. This may be accompanied by weight gain. On the other hand, some people actually lose their appetites and tend to lose a significant amount of weight. We also see lower energy levels, and for some people, a dull headache may accompany the problem. So, building on the research studies that identified the symptoms of seasonal affective disorder and the high-risk profile, we decided to undertake a longitudinal study of 120 subjects and our research is really focusing on therapies that might help those people affected by SAD. Traditionally, psychotherapy has been used to identify and modify behaviors that contribute to depression, and it's been somewhat successful with patients identified with seasonal affective disorder, especially when used in combination with relaxation and stress reduction therapies. Antidepressant drug therapy has also been proven to reduce depression in studies of people who had seasonal disorders. But we've been using phototherapy almost exclusively with the subjects in our studies. It's very simple, really. We've supplied each subject with a light box that provides the same type of natural lighting that would normally be shining through the window during the spring and summer. The subjects have been instructed to turn on the light box for 2 hours and then simply go about their activities in the room where the box is placed. They're not supposed to use the box like a sun lamp, no staring into the light, either with the eyes closed or open. They just ignore it once it's turned on. So, although we're still evaluating our data from the first group of subjects, we have a few preliminary findings that I'll share with you today. First, we think that it's probably better to be exposed to the light box during the morning hours. Second, we're noticing a relationship between sleep patterns and seasonal depression, so maintaining a regular schedule for sleep seems to be a helpful therapy in conjunction with the light treatment. We're also fairly sure that the duration of light therapy can be modified for individuals. Some subjects who were exposed to the light for less than 2 hours did very well, while others showed no evidence of relief until they reestablished the 2-hour treatments. One interesting possibility that we're working on is whether fluorescent lights might work as well as full-spectrum light with the ultraviolet rays filtered out. In our first trials, we used UV light exclusively, but now we have some trials underway with fluorescent light, and the results so far are encouraging. I'm also happy to report that there are few subjects who are experiencing side effects. There's no evidence of eye damage. We've been careful to filter out any potentially damaging UV rays. And in fact, the only negative side effect was minor headache that seemed to disappear after a few treatments. So, next semester, we plan to begin the second stage of our studies, and we'll be comparing the degree of depression on the part of subjects undergoing light treatments with control groups who'll receive either drug treatments or psychotherapy. What we really want to know is whether light treatments alone are as effective as the other options for therapy.
That is the end of Part C. You now have 2 minutes to check your answers.